The video is titled Occlusio Pupillae in a Complicated Cataract. This occurs in a case of long-standing uveitis which has not been treated very well. First, side port incisions are made using MBR plates. Now, AC is filled with viscoelastic material. The synechiae are broken using iris repositors. This step is important so that a little bit of iris is exposed, and we have to make sure that we do not damage the anterior capsule of the lens during this step. Now the main incision is made and the major India pupil expander is implanted into the eye. All its four flanges are engaged onto the edges of the pupil. We have to do it slowly so that the iris is not torn while doing this procedure, since this is a uveitic iris and it is fragile in nature. Now we have to remove the viscoelastic which is already there in the AC, because we have to stain the capsule, as it is a mature cataract and I cannot see the capsule very well. Now, under the air I will stain the capsule. Now the stain is washed out and the AC is again filled with a high density viscoelastic. Now the rexus is initiated and completed using a 60 tool and a microrexus forceps. I made sure to make a large rexus because I found that this cataract was very hard. Now phacoemulsification is done using one's own preferred technique. I prefer to do a stop and chop. In this method, the first break is most important. After that, it's smooth sailing. After nucleotomy is completed, I will fill the AC with viscoelastic. I found that there is hardly any cortical matter, so I decided to skip the irrigation aspiration of cortex and put the IOL in back. This is also done because in these kind of cataracts the capsule can be very fragile and can get caught in the eye. Now the IOL is dialed into the bag and the expander is explanted. First, the flanges are disengaged from the pupillary margins. And now, from the main port, the expander is pulled out using a McPherson's forceps. Keep your repositor above the expander below the cornea so that it doesn't touch the cornea while being explanted. IA is done to remove all the viscoelastic which is present in the AC. We can see the iris is very floppy as it is getting regularly caught in the IA probe. Stromal hydration is done. There is some remnant membrane present, which I removed it. And the stomal hydration is completed. After this, IVTA was given, and on the post-op day 1, the cornea was quite clear. There was no AC reaction. The patient has 612 uncorrected visual acuity. Thank you.